Welcome to WA Health and Care, where knowledge inspires healthier lives. Today, we're exploring the truth about cancer, what it is, its causes, symptoms, treatments, and how to prevent it. Awareness can save lives, and every small step toward prevention truly matters. Let's begin this important journey together. What is cancer? Now we explains what is cancer. Cancer is not a single disease but a group of over 100 related diseases that all share one main feature, the uncontrolled growth and spread of abnormal cells in the body. According to Dr. Siddhartha Mukherjee, one of America's most respected cancer specialists, cancer begins when the very genes that control cell growth and repair go wrong. In a healthy body, cells grow, divide, and die in a precise and organized manner. This process helps the body replace old or damaged cells with new, healthy ones. But when something disrupts this natural system, such as DNA damage or genetic mutation, the cells begin to grow out of control. These abnormal cells can form a mass or lump called a tumor. There are two main types of tumors, benign and malignant. Benign tumors are non-cancerous. They grow slowly and don't spread to other parts of the body. Malignant tumors, however, are dangerous. They invade nearby tissues and can spread through the bloodstream or lymphatic system to other organs, a process called metastasis. Once metastasis occurs, the cancer becomes more difficult to treat. Cancer can develop almost anywhere in the body, the lungs, breasts, prostate, colon, skin, or even in the blood. Each type is named after the organ or tissue where it begins, for example, lung cancer, breast cancer, or leukemia. Several factors can cause cancer, including smoking, alcohol, poor diet, obesity, environmental toxins, radiation exposure, and inherited genetic mutations. While some risk factors are beyond our control, lifestyle choices play a major role in prevention. At WA Health and Care, we believe that knowledge is the first step toward protection. By understanding how cancer starts, people can make healthier decisions, like eating nutritious food, staying active, avoiding tobacco, and getting regular screenings. As Dr. Mukherjee reminds us, the fight against cancer begins with awareness and early detection. The earlier cancer is found, the higher the chance of successful treatment and survival. What are the symptoms of cancer? Now we discuss the symptoms of cancer or early stage. Cancer can affect nearly every part of the body, and its symptoms can vary greatly depending on the type, location, and stage of the disease. According to Dr. Lisa Richardson of the U.S. Centers for Disease Control and Prevention, CDC, many cancers begin quietly, without pain or obvious warning signs, which is why awareness and regular screening are essential. At WA Health and Care, we aim to help people recognize these early signals before the disease becomes more serious. One of the most common and noticeable symptoms is unexplained weight loss. If a person loses more than 10 pounds without any change in diet or exercise, it can be an early sign of cancer such as those of the stomach, lungs, or pancreas. Another key symptom is persistent fatigue, a constant feeling of exhaustion that doesn't improve with rest. Cancer cells can drain the body's energy and affect how it uses nutrients, leading to this overwhelming tiredness. Unusual lumps or swelling are also major warning signs. These may appear in the breast, neck, underarms, or other parts of the body. Any new or growing lump should be examined by a healthcare professional as soon as possible. Changes in the skin are another red flag. According to the American Cancer Society, new or changing moles, sores that don't heal, or skin discoloration can signal skin cancer. Likewise, jaundice, a yellowing of the skin or eyes, can point to liver or pancreatic cancer. Other common symptoms include persistent pain, chronic cough or hoarseness, difficulty swallowing, unusual bleeding, and changes in bowel or bladder habits. It's important to note that these signs don't always mean cancer, but if they last longer than 2 weeks, they should never be ignored. As Dr. Richardson emphasizes, early detection saves lives. The earlier cancer is found, the higher the chances of successful treatment. At WA Health and Care, we encourage you to stay informed, listen to your body, and schedule regular medical checkups. Awareness is your first defense against cancer. What are the causes of cancer? Now we discuss the causes of cancer or early stage. Cancer develops when normal cells in the body are damaged and begin to grow uncontrollably. It doesn't usually have a single cause, rather, it results from a combination of genetic, lifestyle, and environmental factors. According to Dr. William G. Nelson, one of America's leading cancer researchers, most cancers are not inherited, but triggered by the way our genes interact with the environment we live in. At the core of cancer's development is DNA mutation. DNA contains the instructions that tell cells when to grow, divide, and die. When these instructions are altered, due to damage or copying errors, the cell may start to behave abnormally. Over time, these mutated cells can multiply uncontrollably and form tumors. One of the most significant and preventable causes is tobacco use. Cigarette smoke contains thousands of toxic chemicals that directly damage DNA and cause lung, mouth, throat, and bladder cancers. Similarly, excessive alcohol consumption increases the risk of liver, breast, and esophageal cancers. When smoking and drinking are combined, the risk becomes even higher. Another major factor is poor diet and obesity. Diets high in processed foods, red meats, and sugars can create chronic inflammation in the body, a key condition that allows cancer cells to grow. On the other hand, a diet rich in vegetables, fruits, and whole grains can help protect cells from damage. Radiation and environmental exposures also play a major role. Too much exposure to the sun's ultraviolet, UV, rays increases the risk of skin cancer. Pollution, asbestos, and certain industrial chemicals can also trigger DNA damage. Infections can contribute as well. Viruses like human papillomavirus, HPV, and hepatitis B or C can alter cell DNA, leading to cervical or liver cancers. At WA Health and Care, we share Dr. Nelson's belief that prevention begins with awareness. By quitting smoking, limiting alcohol, maintaining a healthy weight, protecting your skin, and getting vaccinated against cancer-related viruses, you can significantly reduce your cancer risk. Cancer may not always be preventable, but informed choices and early screening can save countless lives. What are the treatments of cancer? Now we discuss the treatments of cancer or early stage. Cancer treatment has advanced dramatically in recent years, combining medical innovation with lifestyle and nutritional support. According to Dr. Julie Grallo, one of America's leading oncologists, effective cancer care is no longer just about removing or killing tumor cells, it's about healing the whole person, physically and emotionally. At WA Health and Care, we believe in spreading awareness about both modern medical treatments and natural ways to support recovery and overall well-being. The main treatments for cancer include surgery, chemotherapy, radiation therapy, immunotherapy, and targeted therapy. Surgery removes tumors or affected tissues from the body. Chemotherapy uses powerful medicines to destroy cancer cells or stop them from multiplying. Radiation therapy uses high-energy rays to shrink or kill cancer cells. Immunotherapy strengthens the body's immune system to fight cancer naturally. Targeted therapy focuses on specific genes or proteins that help cancer cells grow, allowing doctors to treat the disease more precisely with fewer side effects. Alongside medical treatments, exercise plays an important role in recovery. Light to moderate physical activity, such as walking, yoga, or swimming, helps reduce fatigue, improve mood, and maintain muscle strength during or after treatment. Studies by the American Cancer Society show that regular physical movement can also lower the risk of cancer returning. Nutrition is equally powerful. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and omega-3 fats can support immune function and repair healthy cells. Foods such as broccoli, berries, garlic, green tea, and turmeric have strong antioxidant properties that help the body fight inflammation and oxidative stress, two key factors in cancer development. Some medications may be prescribed to manage side effects like pain, nausea, or fatigue, ensuring patients maintain quality of life during treatment. At WA Health and Care, our mission is to remind people that treatment is a journey of strength, awareness, and hope. With modern medicine, healthy living, and early diagnosis, millions of people are surviving cancer today, and you can too. What are the precautions for cancer? Now we discuss the precautions of cancer or early stage. Preventing cancer begins with awareness and smart daily choices. According to Dr. Otis Brawley, one of America's leading cancer prevention experts, up to half of all cancers could be prevented through simple lifestyle and environmental changes. At WA Health and Care, we believe prevention is the strongest defense. The first precaution is to avoid tobacco in every form, as smoking remains the leading cause of cancer worldwide. Limiting or eliminating alcohol use also reduces the risk of liver, breast, and throat cancers. Maintaining a healthy diet rich in fresh fruits, vegetables, whole grains, and plant-based food strengthens the immune system and protects body cells from damage. Regular exercise, even just 30 minutes of walking a day, helps regulate hormones and control body weight, both key to lowering cancer risk. Protect your skin by using sunscreen and avoiding long sun exposure. Get vaccinated against HPV and hepatitis B, which can prevent certain cancers. Finally, attend regular medical screenings such as mammograms, colon tests, or blood exams for early detection. At WA Health and Care, our message is clear: prevention, awareness, and routine checkups can save lives, including yours. At WA Health and Care, we believe awareness is power, and early action is protection. Stay informed, live healthy, and never ignore the warning signs your body gives. Now we'd love to hear from you. Which topic should we cover next? Mental health, heart care, or immunity tips?